My name is Sami Elamin. I'm an internal medicine physician at Massachusetts General Hospital, and I teach medical students at Harvard Medical School. I'm also a gastroenterology and hepatology researcher. And I have a very special affinity for how to blend technology with medicine to serve populations that live in areas with little to no infrastructure. The world of biotechnology and digital health is full of hype and buzzwords and very little real tangible results. My mission after leaving Sudan was to become an excellent physician first and foremost. I then moved to Boston to be at Harvard and surrounded by people who are coming up with the latest technologies in medicine. I wanted to see what the buzz was all about. And so I spent 4 years in Boston. I did a year of Connected Health Innovation Fellowship. This was a space where we were allowed to ask ourselves, how can I, as a physician, leverage technology to expand my reach beyond the patient that is sitting in my office without limitations? So naturally, for someone like me, who is originally from Sudan, the question immediately comes to mind. How can I transfer everything that I've worked so hard to learn to benefit my own country? Especially at times when I'm physically unable to go back. You can actually be in two places at the same time. We've all heard of remote patient monitoring, wearable healthcare devices, point-of-care testing. Internet is expanding, especially in Africa at the fastest rate. So basically, I was in Boston, practicing medicine at one of the largest academic medical institutions in the world, and I couldn't reach the person who needed me most, which is the Sudanese patient. Okay? So how do I get around that? Okay. I think the people who have come before us have failed at making any significant changes when it comes to healthcare because I believe that their approach was backwards. They come into the country, they see that we're made up of roughly 40 million people, and quickly become overwhelmed by the task of providing high-quality healthcare to every single one of them. And I think that is the nature of any project that you get involved in. If you try to start big, you'll stretch yourself too thin, and eventually you'll fail. Okay? And so we developed the concept of patient zero. Myself, a lot of brilliant colleagues, some of them Sudanese, some of them non-Sudanese, very well educated, Columbia Business School, Penn, University of Toronto, Hopkins, Harvard Medical School. And we really sat down together. We were like, if we had one patient in Sudan right now, okay, and we have multiple very competent doctors here in the United States, how do we deliver care to that patient? The answer that we came to was, you need a physician in the US, and you need a physician on the ground in Sudan who is going to be your right arm. At the end of the day, there's a lot of buzz about telemedicine and virtual care. But at the end of the day, I can talk to you through a screen, but I can't touch you. I can't give you medication. I can't take your vital signs. I can't do a physical exam. I can't intervene. I can't do anything. All I can do is talk to you and see you. And so we sought out some of the best young doctors, the brilliant minds here in Sudan. We go through a process to onboard them. It's very important to ensure standards of quality and patient safety. Okay. So each and every single Sudanese doctor who joins our team goes through 3 stages. The first stage is pre-selection. So you go ahead and ask around, who's good? Who's the good doctor? They develop a reputation. Number 2, you train them really well. And number 3 is you have to monitor them continuously to ensure quality, okay? And so once you have that team, a physician who's abroad that has a lot of knowledge, someone who's really caught up on what the latest research is suggesting, and you have a brilliant, motivated, young Sudanese doctor who is hungry to learn, and this basically makes up the team that takes care of patient zero. So you have one physician in the US and one physician in Sudan. Okay. Then what happens? We started with a virtual visit, the patient in Sudan, together plus or minus a loved one who's abroad, in addition to the physician in the United States and the physician in Sudan. So all of those people meet virtually for the first time. This is the most important visit because we perform a comprehensive medical evaluation. We talk about the patient's entire medical history from the day they were born until the day we see them. Any medications they've taken, surgeries they've had, and the list goes on. After the initial virtual visit, we come up with a plan together with the ground doctor. All right, well, those are some tests that we need. I think this patient needs refills on certain medications. They need follow-up on certain vital signs on a more robust basis. So what we develop a plan, we send it to the ground doctor who goes to the patient's home, and with the use of some of the latest technologies, we're able to see blood test results within a few minutes using devices like the iStat Abbott. We can get an EKG from a device where the patient just puts 4 fingers as opposed to having wires stuck on their chest. And we also use wearables like my watch. So from my couch in Boston, I can tell whether my patient had enough sleep last night. I can tell whether their heart rate was too low or too high. And so once the results come back after the ground physician visits the patient in the home, we have a follow-up virtual visit. This follow-up virtual visit is also done with the same stakeholders that were there in the initial one. We discuss the results of the labs and the investigations, and we come up with a plan of treatment for the patient. Now, this completes the cycle of patient zero. Okay. Perfection is impossible, but we should aspire to it. In medicine, there is a concept known as quality and process improvement. Why did we fragment it down into patient zero, just one patient? We really wanted to focus on that one patient and figure out what exactly does this patient need to have an excellent outcome as a result of our medical care. We made mistakes on the first encounter. There were deficiencies in our processes. They were not as efficient as we wanted. We improved with the second patient. We improved with the third and fourth patient. And we now serve hundreds of patients in Sudan. However, we did not expand from patient 0 to patient 100 overnight. This was an extremely lengthy process. It required a lot of input from a lot of people who know exactly how to deliver high quality and safe care. I think I have to repeat the word safe care because in medicine, the first rule is do no harm. So if you're not going to make the patient better, please don't make them worse. And we've seen a lot of success with the initial patients. So if we didn't see success with patient 1, 2, 3, and 4, we never would have proceeded to engage hundreds of subscribers. Now, this is a for-profit entity, first and foremost. However, it has a very strong social responsibility on it. And this takes me back to the question, if I'm located in Boston and I want to treat not one patient in Sudan, but 40 million, I want to provide international standard healthcare services to 40 million Sudanese patients or Sudanese people in a place that has little to no infrastructure. The answer is very simple. You need a competent physician abroad, a competent physician on the ground who's going to be the US physician's right arm. You need the help of technology, like wearables, like point-of-care testing, okay? And at that point in time, it's a matter of scaling up without compromising quality.
So you just lay out the ground.
Let me start by saying that this really depends on, we thought long and hard before entering the Sudanese market because we are aware of the challenges that exist here. We functioned in a lot of other places. However, I could just not ignore Sudan because this is where I'm from. However, some of the challenges that we face come from governmental authorities, local businesses, Sudanese citizens within and outside of Sudan. And those are mostly related to importing medications, medical equipment, creating partnerships with leaders in industry and policy. There's a book that I'm a big fan of. It's called Outliers. It's written by one of my favorite authors. His name is Malcolm Gladwell. He talks about the theory of success. He challenges the theory of success in that book. So he looks at people like Bill Gates or some of the most successful athletes. What gave them an edge? Why did they succeed? The bottom line of that book is that the environment where you grow up has a lot of influence on where you go in life afterwards, correct? I've worked hard. I still work hard every day. However, there were opportunities that were available to me that were not available to the Sudanese citizen. So I have to acknowledge that first before I talk about my successful journey. It was still not easy. I took risks. I doubted myself along the way, a big deal. I used to run here when I was in medical school in Sudan. I used to run in the morning before med school on Fishar Hanid. And I would wonder at the time, like where am I going to be 5 years from now, 10 years from now, 15 years from now? I would wonder, am I making the right choices? Am I doing the right things? And those thoughts usually come with a lot of anxiety because you're dealing with the unknown, right? And it can be a very distressing time, especially for someone who's young, not too experienced, hasn't been out in the world for too long, and is living in a very, very challenging and non-forgiving environment like Sudan. I think what made a difference, besides the fact that I had a nurturing upbringing, was some degree of being unrealistic. I asked myself simple questions like, what does the person who goes to Harvard have that I don't have? Or what are the qualifications that they have that I don't? How are they different than I am? And there's only one way to find out. You gotta go there and you gotta see them and you talk to them. You look them up, you go on their website, see if they have any opportunities. You chase it, you find mentors, you find people who went there. And I think if you truly, really believe that it's possible, regardless of the obstacles, and you're willing to be patient, I think being patient is key. I was in a rush when I was in my 20s. I wanted to make it right here, right now. But a message I want to send to young people is, we do hear about overnight successes, Justin Bieber, or whoever it is, but those are the exceptions to the rule. Okay. Focus on your craft. Focus on what you're doing here and now. Have a goal in mind that excites you to the point that you jump out of bed in the morning.